So our purpose here is to decode pain. And I think the module 0 needs to start from this exploration. And I will from now on refer to pain as a pain experience, because the first message to me, to those who don't think about it that way yet, is to try to frame the experience that we feel as pain, which is usually negative in our consciousness, right? Lots of emotions that are difficult to manage. We can say to treat it as an experience. So my first message is to you, it's not a thing. Pain is not a thing that lives in your knee, in your back, in your head, that comes at you from maybe you believe some outside forces. So it's not a thing, and it's not from outside. It's our experience. And think for yourself as complex, unavoidable, but very important, protective and necessary experience for us. It is something that we can have a relationship with, that we can modulate and influence on a different level, because being complex, pain presents different elements to us. As a second takeaway today for you to remember and to reflect upon, or maybe argue with me, is that science, neuroscience and psychology especially, presents us with a hypothesis that pain is made in the brain. And as most of you know here, pain is a product, in our consciousness, is a product of what our brain judged to be important for us. So components of the pain, there is a perception. In that instance is a nervous system that presents the brain with an input. And that input is something that we usually relate or think of as injury. And that's the simple explanation, that if there is a damage, there will be a firing of our nervous system, of our neurons, which will communicate from periphery, because pain or injury can happen in any place on our body, inside or outside. And the brain then, as a second component, if you like, will decide if this is an important message and how much it should let us know that we are in danger. Okay, so just knowing that there are these two components, think about it, how this perception of pain is constructed, and how can we intervene and modulate it on that level. Thank you so much. Yes, hello everyone. I'm so glad you made it and you're here. Again, I thank Tricia very deeply and gratefully, acknowledging her efforts to bring neuroscience to the public and all her work. And I welcome my colleagues, see a few of you. I'm so grateful for your presence and support. I would love your input. Yes, I would really like for us to bring today to this space whatever is important for you, whatever brought you here, whatever you know about pain, what you want to know. I would like it to be more of an exploration. So our purpose here is to decode pain, and I think the module needs to start from this exploration. And to explore the pain, and I will from now on call the pain experience. I will refer to pain as a pain experience, because the first message to me, to those who don't think about it that way yet, is to try to frame the experience that we feel as pain, which is usually negative in our consciousness, right? It's painful, lots of emotions that are difficult to manage. We can say to treat it as an experience, the whole package. So my first message is to you, it's not a thing. Pain is not a thing that lives in your knee, in your back, in your head, that comes at you from maybe you believe some outside forces, like people used to believe that it's been inflicted upon them. It's to suffer. It's to make sacrifice to that entity who gives us pain, and we can't do much about it, and so on. So it's not a thing, and it's not from outside. It's our experience. And as every experience, you probably may agree with me, it has its components, right? So my takeaways and my whole series are built around this notion that pain is experience. We have a pain experience. We're experiencing a thing that is called pain, right? And so for reason of shortness, I will still use the word pain, but if you could please help me to present it as an experience and think for yourself as a complex, unavoidable, but very important, protective and necessary experience for us. So we are here to explore the components of the pain, because apart from understanding that it's important and protective, it is something that we can have a relationship with, that we can modulate and influence on a different level, because being complex, pain presents different elements to us. And interventions to moderate pain, or to diminish it, or to make it manageable for us, are possible on many levels, on many components. We can so-called play with many components. And I will talk about these components in details, but as a second takeaway today for you to remember and to reflect upon, or maybe argue with me, is that science, neuroscience and psychology especially, presents us with a hypothesis that pain is made in the brain. And as most of you know here, so forgive me the simplicity, pain is a product, in our consciousness, is a product of what our brain judged to be important for us, right? So components of the pain, according to neuroscience and psychological sciences, are as follows. There is a perception, so there is a physical mechanism in our body. In that instance is a nervous system that presents the brain with an input, and that input is something that we usually relate or think of as injury, right? As damage. And that's the simple explanation, that if there is a damage, there will be a firing of our nervous system, of our neurons, which will communicate from periphery, right? Because pain or injury can happen in any place on our body, inside or outside. And that kind of injury or intrusion, breakage of our skin, wounds, or internal disruption of organs would be communicated via the peripheral nervous system. So all the neurons that are having that function inside our body and in our spinal cord, gathering information about that and firing messages towards the brain. And the brain then, as a second component, if you like, will decide if this is an important message and how much it should let us know that we are in danger. Okay, so just knowing that there are these two components, we can then, in a future workshop, think about it, how this perception of pain is constructed and how can we intervene and modulate it on that level, right? So I will talk about it another time in more, if you like, technical, but also simplified details. So we know when we have acute pain, that is a response to injury, how this arises in our consciousness, how we know we feel hurt, that we're in danger, and so forth, so on. After that, brain decides it's dangerous, it needs us to take actions, right? That's why we have the next component, which is the cognitive one. It's a motor one in some instances, obviously in a simple in a simple situation, like when you touch the stove, you motorically don't have to think about it. You have impulses to withdraw you from situation that are the most dangerous for us and also most simple, if you like, to assess, right? So fire, heat, too much, burning, withdrawal. But of course, life is not as simple. We've learned not to put our hands into the fire the first time, probably. We've done this. And we're dealing with much more complex experiences of pain in our life as it progresses. And therefore, another message to you is a key takeaways that we have these two, if you like, different types of pain. A pain which is acute, which I just described and talked about it, that signals us immediately a danger, an injury, injury that is dangerous to our body, and forces us to react, to take action. So I, for example, broke my leg, and obviously the acute pain stopped me going, walking, and achieving another, mountain peak. So I immediately had to seize the actions I wanted to enjoy and submit myself to taking care of my leg. So that's the pain that it's acute, it's a response to something that happens to us, and it's dangerous. And we need to take action to protect ourselves. So I like to think about it as a language of the body that tells us that we are in danger and we need to protect ourselves. So sometimes you will hear people making meaning of pain as something that is teaching us, don't do this, honey, anymore because it's not good for you. So it's teaching, is relearning through pain, right? But there is the other type of pain that could debilitate our lives. We probably know about it, if not from our own experience. We heard about people suffering from chronic pain, which is unrelated to injury, or it persists after injuries. And you can think about people who had an operation and everything healed and everything is well, and 3 months later, they still experience different pains, even bigger than before operation that supposedly fixed the problem or the injury, right? So we will talk about it in a second as well, in a more deep level. As we said, it's very important to know that pain is important, unavoidable, protective, but complex. And the complexity, first level is, it could be acute, so in response to injury, but also it could be chronic pain, which in itself, it's malfunctioning of the nervous system, as we like to think about it at this stage in the research academia, right? And again, how it happens and how to deal with this will be very different of the treatment of acute pain. And we talk about it, and I would love to know your experience and what you think about it. So I would love to explore this concept with you. And for that, I need to know who's in the room. If it's possible to put the camera on for just a short second for anyone. And because we know too many, maybe you could just go around and say literally 3 sentences, or however much you want. And I'd love to know who you are from the point of view why you're here. Is it for personal reason? Is it your health professional or your academic? Anything, that is your persona that wants to know about pain. And I would love to know, how would you describe your relation with pain? Meaning, also, what do you know about pain? How do you think about pain? So who do we start with? Tricia, help me out.
Okay, so I can start. So if we're talking about chronic pain,
Anything
yeah,
that comes to you, how do you know you pain experience?
me, pain is
Knows
like
pain.
this. So it oscillates depending on the day, the context, the environment, how tired, etc. And it has a direct impact on well-being as to how I perceive it on those days. So
Have you got a word or two to describe your relationship with pain? What comes to mind? Okay. Oscillating,
oscillating.
fluctuating. Okay. Brilliant. Nicola.
Yes. Hi. I'm here because of you, Anita, and I'm very interested in hearing your perspective of it. I work with patients that also have a lot of pain, different kind of pain, not acute. And my outcome will definitely be how to talk to them about it, learning more from you from today and the other days, not only today. But yes, it's a huge topic, and it's a topic that for me is really interesting because of my clients. So that's why I'm here. I don't have any pain myself at the moment, so sorry about that.
No. We'll help you in the future, I guess, if it needed. Maria.
Hi. Great to see you. Well, I'm here because I'm really looking forward to participating in your session and learning from your wealth of knowledge. With regards to pain, I have had experiences personally. I had a prolapse disc many years ago, and I don't have any pain anymore. I also used to suffer from migraines just from, stress and work stress and burnout, which now I work with clients in a corporate world who, of course, experience these types of things. I have a lot of respect for pain and the relationship that we have with it. And I still get sometimes triggered if I start to get a headache. Immediately I go into the, oh no, it's going to be a migraine, even though I haven't had a migraine for decades. But I can sense that it's still sort of deeply rooted in my nervous system. And of course, then I'm now able with the tools to sort of release that and frame it in a new way. And then, of course, I never get a migraine. But yeah, so that's a bit my relationship with it. And I'm super curious to find out more about the science behind it.
Thank you. So I know also of Kimi, so I asked Kimi if he can tell me how does he think about pain and what is he looking for?
Hi, Anita. So, I think my relationship with pain, having worked in sport for the majority of my career, is that, and I think we discussed this before, is that it's not an avoidable thing. It's somewhat inevitable in the realms of sporting endeavors. So, the idea of suffering or even the language that you use to describe pain can be quite provocative, and the way that players, athletes use the nomenclature around pain is quite indicative of how they frame it and what their point of reference is around pain. But I find it a fascinating field, so I'm here, and over the course of this series, I'm really excited to learn more and more about it. But pain, I think, is something that I experience on a daily basis. So it's understanding what is my bandwidth for pain, and I'm really fascinated by the pain tolerance of individuals and what their experience is as people, and where they've come from, their journey, how that influences their perception of pain.
Wonderful. Thank you, Kimi.
Pleasure.
Saskia.
Hi, Anita.
Hello.
Yes, I think like Maria, I'm working with clients also in the corporate world, and there's often people are then ignoring pain or just working through pain. I myself, I do have chronic pain. Yes, I'm a chronic pain patient, I would say. Yeah, and I've looked into the science of it, but also like my own relationship. So it's more like almost like a companion, because I know it is there. Yeah. So it's you can't say it's a friend, but it's also not something where you say it's an enemy, because it's just part of me at this point in time. Yeah.
Thank you for sharing. Rox, please, can you share something?
Yes, it's really lovely to meet you, and great to be here today. So I'm Roxanne, I'm London-based, and also a panel member as well. I think for me, it's more sort of the intellectual curiosity today, and trying to learn a bit more about the topic. I think I've been fortunate enough not to have any sort of chronic pain instances, but as we said, I think pain is inevitable. So I think it's unavoidable. So apart from the acute instances where I'm generally quite clumsy and I always end up with bruises and stuff. But that's, nothing compared to, the chronic pain. So that's what I'm here. So looking forward to hearing more about the topic. Thank you.
Wonderful. Lovely to have you. Felipe, if you awake enough.
Yeah, here I am.
Oh, wonderful. Thank you.
Hi. Well, I've got 7 herniated discs in my back, so I am in constant pain. And my father, he has the same health problem, and he's 87 years old now, so he's still suffering with that since he's 30 something years old. So me and him, both of us, we've been suffering with this problem, and then it's really, 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 really terrible pain. So I'm here to see if I can learn some techniques and understand the mechanisms of pain and how we can deal with that in a better way.
Thank you. Super. Love to see you. And we have Louise, who probably has a lot to say.
Oh no, what, me? A lot to
Yes,
say. No.
about pain. You do work with people who
I do
experience it, right?
people, and also I identified a great deal with what Maria was saying. I was a lifelong migraine sufferer, and indeed had one recently, but it had no pain. So this was fascinating. So I had what was called a silent migraine, but as those who suffer from migraines will know, the psychological symptoms of a fog, not finding words, complete fatigue, and all the rest of it that comes into having a migraine were very, very much present. In fact, more severe, to the point I was wishing I'd had the pain because I might have got through it more quickly. It took me a good 2 to 3 weeks to get through that silent migraine. However, on the client side of it, I work a lot with people who have cancer, brain tumours, and do you know what? They don't often talk about their pain because their physical pain is outweighed, I think, by their emotional pain, which is something I'm really fascinated in understanding, where the pain of your existential pain, being given a very bad diagnosis, can sometimes actually outweigh, during a cancer journey, your actual physical pain. So I'm interested if we're going to cover anything like that. I'm sure we will cover the emotional plus physical aspects of pain. That's all really. I'm here to learn from an amazing woman and an amazing teacher. Thank you.
Oh, thank you so much. I'm so honored to be here with this company, and I learned as much every time I hear you speaking. Anyone else who would like to say something? I respect that when you're off camera, you're probably not able to join our conversation, but raise the hand, or we have Charlie. Maybe she is able to.
Yes. I'm here with 2 ears and 1 mouth, and I was thinking I haven't really got anything to add to this, and then I remembered that I'm an outlier. I had a vagotomy about 9 years ago, so as part of cancer treatment, and so I don't feel the pain of hunger anymore, which is interesting, to live in the absence of that hunger pain. So that is my unique perspective, I guess, or something I can add to the table. I also work with a number of medico-legal clients, medico-legal experts, and I know that pain expertise, finding experts in pain, is something that is rare and much wanted because it's subjective. And being able to compare, particularly when you're trying to make an evaluation on the impact of something upon somebody's life, it's difficult to ascertain. So I'm interested, partly because my background is data, in understanding how you can kind of create a comparison, because everyone feels pain quite uniquely. And as patient zero, I'm bringing that too. So I'm really looking forward to this series. And thank you to Anna for flagging it. Yeah, I hope I can help in some ways to improve everyone's kind of knowledge and experience.
Wow, Charlie, if I can call you a cherry on the cake here, such a rare occurrence of have this kind of perspective and lived experience. So I think you are already an amazing expert on part of the pain field, right? How it is to live without one, or how to then translate that to understanding other people, as you were saying. How do I talk and understand the experiences that are, as you rightly said, so subjective, right? Thank you so much. And I hope I will have a lot of chance to talk with you, or we will hear you. Anyone else that could say something about their relation to pain and can join conversation with anything they have, what you're expecting and what would be helpful? Okay. I presume hearing us, that's okay. And anytime.
Aneta, sorry, I forgot to mention in
Yeah.
terms of experience. So I also have experience actually with pain therapy myself. So like the multimodal pain therapy, which is like, I think at least in Germany, seen as like a gold standard of pain therapy. Yeah.
Wonderful. Wow, wonderful. Again, wow. How many perspectives we have. How lucky I am. Jeez. Okay. I'm so excited to ask you questions now. I don't know how to go about this. Let's maybe start exploring that side of communication of pain, right? Because I can see that lots of you guys are familiar to some degree with neuroscience, with psychology, and we will dive deeper and more about it. But communicating the pain and what it does when we trying to tell other people, and let's say that we need a treatment or we just need accommodation, right? Because when we have migraines, we work differently. When we have back pain, we have different requirements to be at our best and so on. And communicating it, as you may agree with me, it's something that carries a lot of, I may say, stigma, right? In some places, you're not supposed to be in pain because that means you're sick. If you're sick, don't come to work, for example, right? What do you think is the problem? Why we so little talk about pain when we know that from research that every fourth person at this very moment suffers of pain in the world? And when you go to supermarket, you may not necessarily see it or be sensitive to see it, because if we explore the subject further, we probably will find out for ourselves how to read signs that are not verbal. I would like to share with you how I read that or learned to read that. And why, if every fourth person in the room is in pain, we don't know about this? What is it? What do you think are the problems? How can we untangle that? So, like, what is in the sports, Kimi? What kind of barriers to expressing pain, which is for me expressing certain states and giving certain data to the person who then can help you to deal with, or for yourself, right? Even to frame it in a way that will be helpful. So let's start from what's the problem in sports? People talk about pain, they don't.
Yeah, I think
How they do it.
pain is a very interesting topic in sport I think for a few reasons. Firstly, it's somewhat taboo to a degree because the impact of experiencing pain impacts your ability to do your job ultimately. So as an athlete, there is a bandwidth, and I've used that word before, but there is a kind of a scale of what an acceptable level of pain will be. Now, if you exceed that level of pain, there's obviously that highlights and that flags that there might be some degree of a significant injury or something that might ultimately, when you look at what that means, it means that you're not able to perform or you're not able to take part in your sport. So that has a subsequent effect on your ability to compete. And I think the cold hard reality is then that's going to affect your ability to have an income, provide for your family. So there's a lot of almost like throwing a blanket over the idea of experiencing pain. So the transparency from athlete to physio or to coach, it can be a little bit guarded. Now, that's kind of the brass tacks of it, where there is a little bit of a a tiptoe and eggshell effect around pain and the experience of pain. This is just kind of the contrast in my own head, is that I wonder, is there a little bit more to it behind the scenes around the medication and pain and the business? I think if we're realistic about the amount of money that there is in pain medication, does that then have an effect on the amount of research that's taking place? I don't know. That's me being a little bit on edge about that. So I'm not sure, but I think pain in sport will continue to be a thing. And especially when you're looking at, I had a discussion with Trestra about concussion and the long-term effects of pain and these kind of elements from a damage perspective. They're massive. So yeah. And I think Charlie's put a really, really appropriate comment in about the difference between DOMS and injury. This is another one that we were always looking at and always assessing, is what is that fine line and how do you assess that on a daily basis without ready availability of imagery and things like that on a regular basis. So it's a fascinating area.
That's so helpful, so insightful as well, because I guess we can extrapolate that, right, to anywhere else. Probably, I hope Maria will have her insight about this in a work placement, right? And depends where you are and how high you are, and whatever. Pain is something that will prevent you to do the job, or it's presumed, right, that you're not capable of doing your job. And again, I stress that it's presumed, right? Because how many times, guys, we felt pain and we did our jobs to the more than acceptable level. So one thing is in a pain word and in everywhere else, when Saskia was mentioning, and Charlie, the very much subjectivity of what we talking about, because it's ours. So I said in the beginning, pain is ours, right? It's the proprietary tool of nervous system to communicate with us, to guide us, to protect us, to make us alive. And if we can't understand that internally, it's because we have no words. I like to think about the pain at some stage as an emotion, right? If we don't know how to name it, we can't tame it, if I say it. And we will talk about it, that the moment we start thinking that pain is acceptable to express in, we like take off the curtains, what is acceptable level of pain? Let's like for a moment, if I talk to my clients or if you talked about, just let it explore. Again, explore before we can decode, because it's subjective. We need to explore, each of us individually. And some of you asking, how can I help my clients, my people, my family, is to be a guide in this exploration. I hope you know that we have the knowledge to guide people, and starting with allowing them to name it and help them name it. So before we find the acceptable level of pain, right, Jimmy and your sports people, I would throw the question, have you really explored inside yourself what's acceptable for you first? Because I think the first step to then project it or communicate to others, and that will make the whole difference. Because if I come and I say to my family, let's say, or my boss, I'm in pain, I have a migraine, but I'm handling this, right? It's a very different that when I'm trying to hide my pain and things are just becoming overwhelming, more painful, more unmanageable, and then I have to withdraw. So as a first step, can we now make an experiment or make a little thinking about ourselves? What was the last time that I felt acceptable level of pain and I could function? And what kind of pain was it that was the passing my threshold for functioning in a way that I desire towards my goals? And you can either put it in a chat, I would love that, to give me an example when that happened, that the pain was there, but I carried on and I could safely say to the other person, I don't need help and I'm capable. Okay. And then the time when I was not able to do it, but I went for it. You see what I mean? I pushed through the pain, and then what happened? If anyone wants to share loud, welcome. I can tell you about mine quickly. I have mentioned in May, I have twisted my ankle to the degree that was on the top of the mountains and I couldn't go back, obviously, but I tried to push it. When I was in a recovery, I thought 1 month should be enough. Unfortunately, the soft tissues heal for 6 months, not 1 month. It's not a bone. Bone is better in that respect. And I pushed it and I found myself 2 months later still with the third degree. So no healing because I decided I don't feel that much pain. It's tolerable for me. I push it, right? And then I had to recall. But when I was trying to talk about not having a pain, that's why I did my exercises, I was also scolded. Nobody believed me that I don't have a pain, and so on, so on. So yeah, I stopped talking about my pain. I just pretended I have one even because my doctor was like, that's not possible, you don't feel a pain. And lack of pain in that instance made me to depass my threshold for healing, right? To you come back. So maybe that happens in your life when you are injured or in pain and you push through because the level of pain you feel is unacceptable for the other person. I love to know what you think. Louise, maybe you would like to tell me, you wrote something.
Yeah, I quickly summarize it for those not following the chat. I have a double hamstring injury. I got in a biking accident in America. And I spent many years saying, it will be okay, pushing it through. And now I've learnt that it's not okay if I overtrain it. And I just say to the PT, nope, let's stop that one. Let's do something different. Let's tone it down because it's not fixable. It's just lots of scar tissue. So I regularly have physio and I regularly have some massage. But I have learnt to now say stop before working through because it doesn't help it. So that's an interesting learning. I think one of the challenges maybe talking to lots of people who've learned lots of techniques to manage what's happening to them. I've mentioned that one because Kimmy might be interested in that. I've just had to say no. And of course, I'm not an athlete. I'm a 65-year-old woman.
But you still need your
I don't need
as
to
much
prove
as
myself.
that's super important. I mean, raise your hand if you ever pushed yourself through pain and hope that will go away. And it didn't, and it was worse still. Yeah. Nobody has a tip for us how to do it. We were pushing and waking up healthy. No, unfortunately, me neither. I have researched it.
I mean, there's a difference between the pain you experience if you push yourself on reps or you got a new weight and you're doing something different. But when you have an injury, the pain is different and it's a long-term injury. It's a different pain. I guess I know the difference now.
But again, even pushing through exercises and straining ourselves, that's also questionable if you should go and push through the pain, right?
Yeah.
Because again, we're coming back to the baseline. What do we feel as tolerable pain? And for me, is a pain that does not disturb me in continuing with my goals. Let's just say, could be reading, could be swimming, could be enjoying my friends, could be work, right? So I would say, like, what is it? Find the place where you were okay pushing, and just note that. The same from whoever asks me, and that will be the baseline. That yes, pain is with us. With many of us already know that sometimes it stays and it does not destroy us, because again, pain is not here to destroy us. Pain is to make us aware of the fact we need to take care of ourselves. And chronic and acute, all of this, we treat them differently, but it's there just to tell us, wait, honey, stop at what you're doing. It's got that wonderful and crushing component of bringing our attention to it, right? Nothing brings us so much to present like pain in the body. And at that moment, can we ask ourselves, what kind of level it is? And if it is something that I know from experience as well, that if I push through it, it will not give me the results I want at the end, right? And Kim in sports, you know, probably that more than anyone. and it doesn't have to be injury. That's the point. This is a signal, right? Just stop and try to decode it. So whenever you got that signal that, oh, it's painful. And the same for physical, and coming to Louise for emotional pain, I think. When it's a signal, we stop and we listen, like red light. Maybe it's just yellow, right? And it would be good to stop and ask ourselves, what is it that I'm feeling now? And is it acceptable that I continue doing what I'm doing, or I just need a little bit more time on that red light, right? Stop. And why I'm saying that, I'm thinking that we may be, you've already know what I'm going to say, but I will just summarize what was in the room, that we know that pain has these components. So when we sit on a red line, right, and let's forget about the acute pain for the moment, right? Not the pain that I presume for now that we know what it is, we respond to it, and we take good care of ourselves. But the pain that we so-called don't understand, right? It just comes up. Don't understand in a way, I don't know why I have migraines, right, Louis? It's very, very unexplainable type of pain, and that goes for most of the chronic pains. Some of the chronic pain is related to a nerve injury or inflammation, right? But lots of it is not, right? And we keep for years had these messages that the scan doesn't show it, the test doesn't show it, there is nothing wrong with you. You have perfect back and you're suffering, it's all in your head. Unfortunately, it was very derogatory to talk like that to patients, but it's true somehow that from the instance that our brain decides that I am in pain or not. Because you probably can give me now another example when you had an injury and you were oblivious to it. Give me one, Kimmy.
This happens all the time. I think it's such a regular occurrence. But I think what you touched on there moments before around, I used the idea of a faulty fire alarm, whereby it's far better for the house if you have an alarm that goes off more frequently than it needs to. But you often find this with athletes or performers with a long injury history, is, as you said, once the scan almost signs things off and it looks like there's really positive and everything's healed, you still experience that pain. So that's always an interesting discussion to have with athletes. And I wonder kind of how you go about navigating that.
Yeah, we're spending a little bit of time right now, or I'm spending with you, to try to pin down the experience before we go into this, because I guess I may safely say that there isn't a pain without danger, right? Our nervous system will not signal something. And I'm emphasizing pain without danger. It's a signal for danger, not necessary injury or damage. And that's, what is the step from what we used to think about years before, right? Before we thought injury, pain, no injury, no pain. You're making it up, whatever. No, we know now that brain will communicate to a consciousness the importance of experience only if it's dangerous or very beneficial for us, but in this case, dangerous, right? And so in many instances, chronic pain, you can say it's an aftermath of injury. Or in some instances, let's say half, whatever, don't take me for words, but for simplicity. The pain does not come out of nowhere, right? And when you're talking about chronic pain in this follow-up to injury, how often it happens, like Louis said, I know I had migraine. Maria said, I had migraine. I know I'm getting them. I know all the symptoms. My brain goes on alert. Pain, 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 right? And then Maria already shared with us, we can address that alert, that faulty alarm you said. I'm not sure if I call it faulty. I would call it oversensitive, right? Especially in the people who experience lots of pain, try to, overcome it for some time, and at some stage, they supposedly have no injury and bang, they own pain. Because the brain was learning that the situations you put yourself in are dangerous to you. And it gives you all the kind of signals via peripheral system, via peripheral neurons. And unfortunately, we're ignoring it, right? In so many cases. We're ignoring it. So what can it do? It can then employ the whole central nervous system to impose on us the need to stop doing the dangerous thing, okay? So the component of pain that makes it chronic is based on the memory of injury, simplistically said, okay, and metaphorically said, okay? So there is no chronic pain without some input or experience of, right, of the physical pain, if you like, or emotional, but we talk about it. And another forms of chronic pains could be to injuries which didn't heal. As I said, neuropathy, right, is an example. Obviously, if you have a damaged nerves or disease which causing a damage to your nerves, that will be kind of different chronic pain. However, every pain, chronic and acute, will have these components, the one we're talking about, biological ones, right? So there is injury, inevitably, there will be a signal. Another component will be, as many of us already mentioned, emotions. Well, pain causes, if you like, implicitly, a negative valence, right? Or brings with itself negative valence. But why? Anyone has an idea? How is it that, oh, pain, terrible thing happening, I don't want it, I want to get rid of it, right? That's what I thought. I'm, in a beautiful peak of the mountains, looking around, it's brilliant and amazing. And oh, my broken leg. Oh, and then I had the whole calendar in front of my eyes. I was on a trip, how I get home. My pain skyrocketed from that moment. Skyrocketed, and I didn't know what happened because with the same injury for 5 minutes, I was just exploring the physical side of it. And then the emotion came and they were all catastrophizing, we call it, right? Because we don't know, but we're already experiencing the aftermath of the pain, if you like. Felipe, what do you think? Is there something about the back pain you're having, knowing, I safely may presume that you have seen that your discs are in the wrong place, and that's a signal of your nervous system that to be careful about it is one thing. But what else? What kind of emotions you have, or talk about what's happening? What does it bring to you on a daily basis when you, ouch, pain, what's next?
Well, I think I say like again, because that pain has been chasing me since I am 16 years old. And for instance, today I am in pain, and then I was just like cleaning my apartment 2 days ago, and all of a sudden I start having like a severe pain, so I could barely move. So it's not a positive emotion whenever I have this pain, and especially because like I am as in a path of working out and going to the gym, and then whenever I have this, it jeopardizes my work and it jeopardizes my gym, trying to be healthy at least. So it's not a positive emotion at all.
But because it's such a long time, you have obviously managed to frame it for yourself. So how is it even possible that you are cleaning your apartment? So bringing up the cognitive, because emotions can paralyze us or make us, feel all these different things, but then the frontal cortex come online as well, right? And helps us to, let's say, overcome, in this instance, the catastrophe of being in pain and making our lives. So
Yeah, and
what do
then
you...
I try to bring in some mindfulness into it. So I'm trying to accept the pain and deal with the pain, see my limitations, and see what I can do to solve that pain in that very moment. So, and then that's the way I manage it, and it works.
Okay, so you're kind of engaging with it, observing it, and figuring out as you go what you can or cannot do, right?
Yes.
Okay, so
Aneta, I think
yeah.
Charlie had a question.
Yes, sure, totally.
Earlier on, I said I just dropped into the chat about coping strategies, because I think if you have a way to manage, or you've got like I mean, I've never had a child, but I know that there's some reassurance for having a birth plan, you know, this program of what you'll do when you will encounter pain, or there's hypnotism can often help, or breathing. But I did also think about learned behaviour. How soon can we get to being children in this scenario, in terms of how you were first introduced to pain as a child and how you were encouraged to manage it, whether you were encouraged to fear it, or whether it was something that was just a necessary part of growing. Have you ever looked at how the way that they've grown up, or that, you know, that introduction to pain, whether that's impacted upon people's ability to manage pain?
Yes, totally. Okay. I think we covered everything right now in the discussion. I would just sum it up for us, what I wanted to bring it to the forefront, and for us to remember when we're trying to decode the pain, that it's got this component. So there's a biological component or physiological, right, component. Anything that is wrong physiologically or anatomically with our body, it will be signaled as a pain. On top of that, there is the emotional component that we bring that modifies or modulates the intensity of what we feel, right? The brain gives us the message, it's important, it's painful. But as you know, we already said, sometimes you never know you had a bruise until you look at this, or you know, your knee hurts and you don't know why, or your back is not good and it doesn't hurt. And we have massive research on showing the kind of inconsistency, right? That's what you were asking. Is there a patient zero? Is the standard for pain? I must say no. Okay, we didn't discover what is it, but we know that on a biological level, we are the same. So we have the same wiring. We have neurons. Well, sorry, we have outliers that makes us outside of the statistically normal population curve, right? We all built of neurons which are serving us to detect pain, and not only neuroception to the neurons who are neuroceptive is called for picking up the pain, but also other sensations are transmitting the intensity of the, let's say, temperature. Okay, if it passes a certain level, it goes as a pain. So we have all this wiring, the biological design as well, how this works, right? So on this level, we can, of course, examine the pain, and we should maybe start with this and address it, okay? And we will be talking about it. Are there any interventions, medical operations, drugs? How can we intervene into biology to stop giving the brain the message that something is wrong? And I have protocols for myself, and doctors do it, depend on which doctors, they check each system if it's malfunctioning on the biological, physiological level. Second part is that we have the psychology, which is felt experience, right? It's like immediately we know that pain intervenes with something important with our life, right? We are afraid of being, taken by it, not knowing what to do. We're afraid of being stopped doing what we, need to do, and so on. As Tini mentioned, this is our jobs, we need to do it. So all this kind of emotions come and basically attach a stress, I like to say, to a pain, right? And we know about mechanism of stress, and I will talk about it, how this influences the perception and the intensity of the pain later, and again, modifying our emotions, I like to say, or addressing our emotions about the experience will, again, influence the level of pain that is disturbing us or stopping us to live our life, right? That takes us hostage. And then the last one is cognition, but it's complicated because, for example, we have language. So we established that is super important. The way we learn exactly to talk about pain, or do we even know that there are different flavors, if you like, that the pain is on a spectrum, that some is tolerable, some it's not, some is stigmatized. So, so we kind of don't talk about it, and we transform that pain into anger, right? Into different kind of expression, because on cognitive level, pain wants expression. Because with meaning-making humans, we need to know what's going on. And how do we make the meaning? Also about pain is we take experience, memory, right? And that's what you touched upon. All our life, we're learning that some pain is this, people talk about it like that I'm allowed, that not. So I like to say that in a cognitive component is our internal, if you like, experience and explanation about what's happening, which is very much, if not totally, derived from our culture and context, right? So, and we express it, of course, with language. So here we go. We've got different modules of pain: biological, psychological, emotional, and the social. I call it social because it's modern cognition, which includes our way of talking about pain to ourselves and to others, which includes learning about pain and what is, culturally allowed and so on. And when we have this whole package, we could see that we can kind of identify which one is most pronounced in the person in front of us or in ourselves. Because if we know we have a chronic pain and there isn't an injury that we can actually address, right, then we may look, okay, maybe I look in this component of emotion, right? Maybe there's something and that's so broad, okay? Emotions, we know that, and Louise said, we can call that emotional pain even, right? Attached to the physical one or without physical one. So again, the language that we describe, it's important to investigate with our clients because they may mean something else that we mean, right? And it's so important that knowing we're the same in a wiring level. So if I even put Charlie into a machine and make her exposed to the certain amount of temperature, she, I guess, will perceive it as a pain that may not have any painful feelings, right? As discomfort or whatever. So we all have a certain threshold for our receptive neurons to communicate something is injuring our body, right? But the uniqueness of it, and that subjective nature, if you like, comes from the elements above. We are the same on the wiring level, but we're very unique in a way that we experience things that happen to us physically, emotionally, contextually, spiritually, relationally, and so on, right? And knowing all this will give us, or each of us already have, some kind of tools, and you must trust yourself. Just knowing that, be sure that this is the three components. So it's complex, it requires time, because chronic pain also arises, in a space of time. Medically, it's not considered before 3 months passes, right? So chronic pain is something after 3 months. And knowing what we all know here a lot about nervous system, this is not anymore the body communicating there's something wrong. This is the nervous system saying we are in danger. And this is very unique for every person. What makes him feel they are not well, that they are in danger. And as Louise said, it could be something very existential. So there is no point of talking about, preventing pain in cancer patients without addressing that kind of perspective. I don't know if you agree, Louise.
Yes, I do, but it's not always the practitioner that you have in front of you who has it in their gift to be able to offer that to them. So I often say, I really don't do that while honouring it, but I really recommend you find the right person for you to talk about the existential feelings that you have, because we're not necessarily all things to all patients. And I think that's really important for us to think about that sometimes.
Exactly. And I think it helped me a lot to know from this, scientific perspective that these elements are real. if you like, right? Those are very real, and influencing one of them will modulate the whole pain experience for that person. How, like Felipe was saying, how do I deal with the pain? What kind of intervention? If my pain is chronic, you can safely assume it's complex, and the complex complex interventions or many level interventions I need to be explored to address it fully and maybe even get rid of it. Okay.
Yeah, I was just going to say with that, and it's, you know, I say it very gently because with Charlie's got really powerful experiences here, but I do a lot of work in the realm now of scan anxiety, and that creates pain for clients. The ongoing processes of the procedures of being a person on a cancer journey creates its own type of experience for individuals. And at the moment, the researchers are starting to wonder whether they should include in the context of scan anxiety, whether it should be a recognised term medically, because there's so much research around it. Two elements that really exacerbate the pain. One is the existential anxieties that we've spoken about and the existential thoughts. And the second one is the fear of reoccurrence for those that are on their journey. And all of these elements are related to pain, both emotional and how that plays out in their bodies, how the interoceptive system plays out within a person's body and turns the slightest thing into pain. That isn't the space everybody here works in, so I don't want to dominate the conversation. I just thought I'd put it out there because I think it's very relevant to what you're saying.
Yeah, and it's beautiful illustration to what is dangerous for us is very personal. Right. Yeah. And we have in research the soldiers being injured, having no leg on the battlefields and fighting or running or carrying a friend off. Right. And you're thinking, this is not possible. Well, it happened, and we have research, and that's how actually pain research started in the first war. The doctor was observing what is happening. Charlie, back to you, right? How is it that there is obviously a pain? It's not possible, right? If I had this, you had this, we'll be screaming with pain. And they are with big smile, because one of the explanation of the person is, I didn't feel it because I was more afraid of losing my life. Or some actually were happy, which was, oh, again, it's like the doctor was out of his head. Why are you so happy about amputated leg? Because now I'm going home, right? I don't have to be in a battle. So this is exactly what Louis said. We have our own perception of what's safe and what's dangerous. And it will depend hugely of the context and the time of our life. Like Charlie, you mentioned, child obviously doesn't have all these files stuck in your head telling you what's good for you, what's safety, what's going to damage you or destroy you. So they try, and they need that guidance. And that's what we were saying. Sometimes rightly, but sometimes not so rightly, I must agree. And you probably find examples. The way we talk about the pain, for example, oh, it's nothing, right? When someone is crying, stops us, stigmatize our own experience of pain, which then makes us to do more damage to ourselves and to society in general, right? Because we know that it's better that someone goes off with cold and recovers for 3 days than works and spreads the virus and pandemic and so on, just with that little example. And we're not talking about productivity and so on. We can talk about it later, how this impacts our real existence in contrast of what we perceive we should or can do, right? Under the influence of pain, especially chronic pain. Yes, so this components, I think if we take away today, and as I said, you already know about it, but it helped me myself to have this like 3 elements in front of me. And instead of seeing a patient and I don't know what to do, or the person, even mother, father, right? Whoa, what is it? How, and of course, there's another story that seeing someone's pain influences greatly. We will talk about it for another hour and a half, how to deal with that before we can help. It's like this person is built of biological material. Okay, we know that. No one here believes otherwise. We help that will dictate how we survive. And our brain and our nervous system is there to bring that element to our consciousness. And that's why I believe we have mind. So together with our body and mind, we can make our way in this life in the most, let's say, comfortable, beneficial way. Call it as you like, guys, for yourself. Some say it happy way, to the end of this journey, right? And through that journey, we have this body which sends us their signal, and the mind which signals us something, and the environment, so society, which signals also their own ways of dealing with given issue, and in this case pain. So don't know if I answer your question, Charlie. And how does it look like now, trying to think about how do I unify and measure pain?
Yeah, but no, it's really interesting in terms of I agree, like the systems, the wiring is consistent. You know, we can all kind of agree on that. But yeah, when you start to think about how that scales into a framework with these 5 key impacts upon or influences rather upon your own unique relationship with pain. Yeah, it's I'm really looking forward to the rest of the series.
Is it helpful for the rest of you? Do you guys see it in yourself if you think about it now? How this component present? Would you trust me to explore it the next time? Do I have something in my biology that bothers my nervous system? How my nervous system, is it adequately responding here in present, or is it making assumptions from the past, or projecting to future? And finally, what do I know about pain? What do I learn? And is that something that is helpful? Right. Yeah, so this is just what I would like to, leave you with to think about and explore for next time. And maybe also, because you are already so deep into the subject for many reasons and thinking about it, you could maybe bring some ideas next time, how, what kind of interventions you yourself figure out, because so many times, like Philippe was telling, we're figuring it out as we go. And also maybe, someone else told you, and again, I didn't hear much of Saskia talking about her experience next time when we talk about therapy and addressing what's available in the space to address some chronic pain. I hope she'll be with us. But if just, breaking down, thinking about pain is an experience, not a thing. It's not a thing that's got the start, the end, clear cut. But thinking this is an experience which we can modulate on a biological level, and here the drugs, the interventions, the different stuff that we talk about it again. And then this is a psychological level, the behavioral habits, thinking about it, emotional, and also the contextual, right? In this context, because we also know that we are happy, we are much more tolerable to pain, right? Even when in pain, we go to the party and we can still dance, right? Which we'll normally, when we wake up, don't do. Why? I don't know. But you see, so if you could think about it, if that makes sense, and maybe explore it with any of your family members or clients, like with your dad, ask him what apart from physical sensation he thinks about his pain, and what he knows, what he believes about pain, and then we can tackle that next time. Anyone would like to add something?
I'm going to say, just picking up on Charlie's point, pain scaling into a framework with components that impact our own unique relationship with pain. All of a sudden, I've got these columns, and I'm thinking about biological pain, psychological pain, and social pain. And I've sort of got these headings, and then I'm thinking about my own pain and how my unique relationship, where they fit, and how I verbalize it, how I think about it. If I go looking for the science behind it, I can put some references in there. And so I've already got this nice way of thinking about it as my takeaway from today. And everything else that everyone has been saying as far as the unique relationship that each has with their idea of pain, their own personal view of
Yeah.
pain.
I love it. Exactly. That's what I mean by decoding. That's what I call the series. We decode it by, knowing what kind of elements make that experience and thinking it's not just happening and I want to get rid of it as one thing, right? In my knee. And if I fix my knee, it will be gone. Oh, it wasn't, and so on. So I don't know if that makes sense as a decoding tool to put it in the categories or examine the categories if there's something biologically, design-wise, anatomically, physiologically wrong. Is there some kind of too much emotional, if you like, or psychological involvement I have with this, right? So called catastrophizing, as we're saying. Is there a stress element that I'm in a stress now and that amplifies any pain that I usually have, but I don't feel? And again, the context, can I get treatment? Can anyone help me? What do I do with what I feel because it's overwhelming and so on? What my parents told me about this, is it okay to feel pain, like Kimi said, or is not? And so on. That'd be wonderful if we could experiment with this and show me if that works as a decoding tool. And as Louis say, absolutely always reserve the right that you can address part of your pain, but some of the parts you have to maybe look for help and speak to someone who may have more knowledge about it, right? So again, the medicaments, the procedures or medical treatments, and nothing that we can administer to ourselves without consultations with medical doctors. I advise, of course, the psychology. If you can't cope with the overwhelm of it, there are psychologists who will know something about it. As Louis said, any type, bring it all together, it will give us the best results in timing it, right? And of course, the type of pains and treatments we will also explore later. So we go into more biological. What do we include in biological sphere? What kind of problems we facing and our people can face, and we can kind of deduct. Again, this is just intended for exactly what Nicola was saying. If I see someone and they come to me and saying, I'm in pain, can you help me? Or maybe even if I don't necessarily want to help them, I can see that this is another layer of the person and it will influence every part of their life. As Philippa said, maybe we're not complaining about it or we're saying it's not, but on a longer terms, it's something to signal to the person and for us to know if we're dealing with someone with pain, it will change the trajectory of the help we're offering as professionals or even as a boss at work or co-worker or friend or family member, right? And we learn about it. Like what I know, how to be as helpful without a special expertise as a first aid provider. Thank you so much for your question and things you brought in. I will incorporate that and I will try to answer as much as possible in the deeper kind of sections when we go on these categories, and we will look what can we explore and do, and then we dive into the science of these components, because obviously today I just couldn't. So that's my framework, this components of pain. Decoding them is useful, I find, and maybe necessary to treat pain of different kind and prevent suffering.
And having an idea of we've got a baseline for our
Yes. So you can observe in yourself something. Just a quick one, very quick. I gave it to Tricia. Many measurements of pain, scales that measures are very inadequate because, exactly as Louise noticed, they don't take into account the full components. So some scales will measure your physical. I will make a, if you like, folder of it, and you're free to to explore it and to compose. But often I put warning against that this is from medical establishment which treats everything fragmentally, right? We know, I mean, our system, that there isn't a nervous system specialist who will incorporate all of this knowledge that we're sharing today. And as Louise said, it will have to be fragmented. But I believe knowing it ourselves and educating others we will be having orientation towards something that is helpful to us, and having that base. I don't know, it will orient us and help us to look for help. So yeah, and next time I will dive into more science, if you like. Now I know who is here. Neuroplasticity, I didn't cover today because I presume safely that all of us are familiar with the concept of it. And that's exactly the concept that makes us learn the pain, right? Or being in pain, and makes us also unlearn, change the experience. So we're learning the experience through neuroplasticity, and we also can unlearn. That's all I wanted to say, and you know how it works. Self-assessment. Again, I hugely encourage you. You know the mindfulness methods. You already have so many tools, Maria. You know what what it is to observe, stay with pain, or identify that experience for yourselves. So many interesting perspectives. I can talk with each of you for a week, I guess, separately and together. And so I won't be doing any exercises of this type because most of you are super familiar. But again, if the pain comes, just remember that all these tools that you have for emotions are very much addressing one of the very important component of pains, right? Or perceptions, or, overwhelm, reducing the overwhelm of input of perceptions reduces the experience of pain, and so on. Yeah, Nicola, what's your thoughts, please?
No, it's been really interesting, and thank you so very much for this. And I like the way it turned, because that's my field. So I'm listening what everybody has to say about it. It's always interesting. And yes, definitely, it's very individually, and also how you work through it, as you are saying. So yeah, so it's been great today, and thank you so much. It's been amazing, and I'm looking forward to next time.
Yes, again, I didn't emphasize the element of talking about pain and communicating, because I see all of you are professionals already in the field, and you know about the respect of, or even gratefulness for our subjective experiences, and you definitely know how to respectfully address this. And but if any question about the language, I will with Tricia dwell on language basis, and I would love your input as well a bit later on in the series if we have time. There's always something, right, about formulating language we can offer each other. So hopefully that's been something to think about, and I can't wait to see you and write to me or whatever. I love that kind of conversation, and thank you so much, Louise, Charlie, Saskia, Tricia, Nicola, Felipe, Maria, and all the rest I couldn't see today. So all the best.
Thank you very much.
Looking forward to next time.
Thank you, everyone.
Thank you so much.